So my name is Dan Weiss, and I'm a public health professional working at the Lake County Health Department as a community data specialist. And I am part of the assessment and planning team at the health department. And one of our primary roles is working with community partners to provide technical assistance to local community health assessment processes. And we formed a relationship with Rosalind Franklin University, a key stakeholder in Lake County, to share our practical knowledge and experience in conducting community health assessments. Now, you can think of the three core functions of public health as three pillars. We have policy development, assessment, and assurance. Community health assessments provide information for problem and asset identification, policy formulation, implementation, and evaluation. So when it comes to improving the health of the community, there are three important things that need to be considered. The health of the community and the factors that affect health are always changing. Data, therefore, needs to be continually collected and analyzed, and it requires a community-driven, coordinated effort to improve everybody's health. Now, mobilizing for action through planning and partnerships, or MAPP, is the gold standard community-driven strategic planning process for improving health in towns and cities and counties and states. The MAPP process consists of 6 phases and is facilitated by public health professionals and engages the community to really use strategic thinking to prioritize important public health issues and to identify resources to address them. Now, it's very important to know that MAPP is by no means a single agency effort, nor should it be. It's an interactive process, including a variety of partners and key stakeholders, to improve the efficiency and effectiveness, as well as the performance of the entire local public health system. So the first phase, Organize for Success and Partnership Development, is part of the planning phase. Now, this phase identifies who should be involved in the process and how partnerships will approach and organize this process. It is important to have a MAPP committee that is representative of the broader public health system. Now, this means that we want to include traditional public health partners like the local health department and the healthcare delivery system. But it is very important to also consider what are known as non-traditional public health partners. And these are sectors in the community that are not involved in healthcare, but still affect the health of the community. Now, these can be included, but are definitely not limited to local municipalities, schools, faith-based organizations, parks and recreation, and many, many more. And it's the role of the MAPP committee to guide and oversee the community health assessment. Now, the second phase of MAPP is visioning. And this is a collaborative and creative process where a shared community vision and common goals are decided on. Now, the third phase of MAPP are the 4 assessments. And these 4 assessments inform the entire MAPP process, so pay attention, this is important. The assessment phase provides a comprehensive snapshot of a community in its current state using both qualitative and quantitative methods. Now, the MAPP framework uses 4 different assessments to gather various forms of data to look at health issues through multiple lenses. The Community Themes and Strength Assessment really provides the qualitative information on how communities perceive their health and quality of life concerns, as well as knowledge of community strengths, resources, as well as community assets. The Local Public Health System Assessment is a tool that tries to measure how well the public health system partners are collaborating together to provide public health services. And this assessment is based on what is known as the 10 essential services of public health. The Community Health Status Assessment provides quantitative data as opposed to qualitative and really tries to capture information about quality of life as well as behavioral risk factors. And the last assessment, the Forces of Change Assessment, provides an analysis of both positive and negative external forces, kind of seeing the impact, how they would affect promotion and protection of the public's health. So after the 4 assessments are completed, strategic issues need to be objectively identified from the data gathered to determine the priority issues a community must address. And these issues are identified by exploring the intersection of the assessment results, as well as determining how those issues affect the achievement of the shared vision. It is often referred to as the Community Health Assessment, or CHA. Now, once the strategic issues have been identified, Phase 5 involves the formulation of goals and strategies. Now, measurable goals and objectives are created for each of the strategic issues that have been identified by the community, and the end of this phase results in a Community Health Improvement Plan, which is an interrelated set of strategy statements and goals that can be adopted in the community, and it's often referred to as the CHIP. Phase 6, which is the final yet continuous phase of MAPP, is known as the action cycle. And this phase includes planning, implementation, and evaluation of the initiatives in the community that were dictated by the Community Health Improvement Plan. And it's also important to know that this is one of the most challenging phases because it's really difficult sometimes to sustain processes in the community as well as continue implementation over time. So next time we are going to be talking about the MAPP process and how it was conducted in Lake County.